Hi everybody, James here. Today is February 9th, 2013, and I've got some pretty heavy news to share with you, my friends and my family and my loved ones. I was recently diagnosed with cancer, and I felt that the best way to sort of share this news with everybody that is important to me, which is you, is to go ahead and shoot some videos that sort of document what I'm about to embark upon. And then I'll do my best to reach out and communicate with everybody as I can individually to kind of talk about what's going to be happening here in my next several months of my life. So today, as I mentioned, is the 9th of February. And just a couple of days ago, I was in Anaheim, California. I was attending a work conference, and I got a call from my oral surgeon who was going to be giving me the results of a biopsy that I had completed on January 31st, 2013. I'll give the backstory to that here in a little bit, but the bottom line is that when my doctor called me when I was in Anaheim, he called me from the Philippines, where he was doing a Doctors Across Borders visit, and he didn't want me to wait for the news. So he called me and he said, James, the biopsy of the mass that was in your gum tissue has come back, and that biopsy is indicative of cancer. And I said, wow, that's some pretty heavy news. What kind of cancer is it? And my doctor said that it was lymphoma. You can imagine what I was feeling and thinking at that moment in time as I sat in a van with a couple of great colleagues on my way to dinner. Your heart just kind of stops for a minute, and you kind of, your head goes into a daze when you hear that nasty C word, cancer. Didn't see that coming. The backstory is this. At the end of November 2012, I had some numbing in my lower lip. My lip would tingle and would go numb. And so I anticipated that I had a dental issue. And so after a couple of days of that numbing, I went to my dentist, who's a great guy. And I said, I think I might have an infection or something. Can we do some x-rays and see what's going on? And so he did, and he did not identify any x-rays as a result of any infection as a result of the x-rays, but he did treat me for an infection nonetheless, because I had some inflamed gum tissue there right underneath that lip that was numb. So he loaded me up on some antibiotics, and after a week or two of that treatment and some steroids, my lip was still numb. So I went back to see him, and he did a couple of more tests and determined that I probably needed a root canal. And so he quickly got me in for a root canal. The root canal occurred, and a temporary crown was placed. And believe it or not, the numbing in my lip continued. So I went back to him and got a permanent crown placed. And he said, we better send you for a second opinion to the oral surgeon who I had seen previously for a dental implant about a year earlier. And so I went to go see my oral surgeon. And he did a CT scan of my jaw, my mandible, and he didn't see any particular growths on the bone of my jaw. But then he looked at me and he said, James, I don't think this is a dental issue. I'm going to get a brain MRI done for you. So we can kind of see what's going on. Something's on that nerve. So, of course, that kind of panicked me when you hear MRI of the brain and don't think this is a dental issue and don't know what's going on. Your mind starts racing again. But I still never thought it was going to be cancer. The brain MRI came back a couple of short days later, and it was unremarkable. There was no growths of any kind in my brain. And that was a blessing. That was a huge blessing. So my doctor, my oral surgeon, said, let me just go into your mouth and cut out a piece of the mass that's on your gums or in your gums, and let's just do a quick biopsy to rule out anything that might be malignant. So I agreed, And as I mentioned a minute ago, on January 31st, 2013, the biopsy was taken, and about 1 week later, on the 7th of February 2013, I got the call saying that the biopsy was conclusive that I had cancer, that it was lymphoma. Now, obviously, this is pretty heavy news. Don't know what stage it's at this point in time. Don't know how far the tumors have spread. We do know that the oral surgeon who took the biopsy was able to get a good chunk of what he could identify as the mass out, but there was some mass still tangled up, likely in my nerve, my main nerve here in my jaw, and he didn't know where the mass ended and began. We don't know much of anything at this point other than I have lymphoma. So, a couple of days have gone by since the original call, and I called over to an oncologist office that my oral surgeon has referred me to, and I've got two oncologists who are going to be teaming up for my case. One is a radiation oncologist specialist, and the other is a hematology oncology specialist who specializes in cancers of the blood, which turns out lymphoma, as most of you probably know, I didn't know, is a cancer of the blood. Since my diagnosis a couple of days ago, we have been able to determine that the particular kind of lymphoma that I have is non-Hodgkin's B-cell large diffused lymphoma. Short of that, and going on the internet, which I've been trying so hard not to do, I don't exactly know what that means. I do have my first oncology visits coming up here in a couple of days, and I hope to get some more answers as to identifying what stage it's at, hopefully, and then moving into some more tests to determine the proper treatment and prognosis and that sort of thing. So with that being said, I will leave you with this. I do ask that if you can, to keep me and my family in your prayers, as this is a pretty heavy time in our lives. As you all know, I'm a very, very faithful man and a spiritual man, and I know that I've got God and Jesus on my side, and so it's just a matter of remembering His promises, and then I'll get through this. So I will continue to give you updates as I get them. And again, thank you so much for your love and support as we embark on this journey.